Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and joining us today to give us a to talk to us about a topic that's really, a hot topic right now. Summer's coming up, and you're probably thinking about maybe losing a couple of pounds before you get into a bathing suit. And so Dr. James Barnes with the Highland Clinic is here to break it all down for us, all things weight loss. Thanks for joining us.
Thank you.
Yes, so you are specifically a bariatric surgeon, so that's kind of your focus of your practice, but you also have, within the last couple of years started offering the weight loss injections, right?
Yeah.
So tell me a little bit about that.
You kind of have to, obesity is such a complex disease process, and I think to really treat it, you have to kind of look at all the different avenues, and that's what we try to do over at the Highland Clinic, is really look at kind of all things obesity, and because there's not just a cookie cutter single answer to this problem. I mean, sometimes it involves surgery, sometimes it's medications, obviously it's talking about diet, behavioral changes. There's just a lot of factors that go into treating a complex disease like obesity. Yeah,
and that's a good way to put it. It's very complex disease indeed, and it's like not one size fits all. So each patient that you see, I'm sure it's a different protocol depending on their risk factors and what's going on.
Yeah, it really is, and I think that's what kind of sets us apart a little bit, is the ability to kind of offer all aspects of treatment. I think if you go to somebody that just does the medications, well, then everybody's going to get treated with the medications, and that's just not always the right answer. And so, and the same thing if somebody's just doing surgery. Sometimes that's not always the right answer either, and sometimes it's a combination of all these things. There's a lot of gray areas here, and it's not always an either or. And sometimes, I've got tons of patients that we use all of that on: diet, surgery, medications, behavioral modification. We offer support groups to help people work through this. So there's just a lot to it.
Yeah. So with, lots of new things that are coming out about these weight loss injections, they originally were used for somebody that maybe was diagnosed with diabetes, but now they've seen it as a side effect, this weight loss. But there's, two different branches. You've got the brand name, super expensive, Ozempic, Wegovy, but then you've got the compounded version that you've used in your practice to give patients an opportunity to take this at a cheaper cost, lifting that financial burden. But there's some new changes that are coming to these drugs. So please explain what you've heard to our viewers.
Yeah, so this is kind of, it's evolving right now, and nobody really knows exactly how this is going to play out. But, so and the way medications work, when a pharmaceutical company develops a new medicine and they release it, they have a patent on it. And so for X number of years, typically 7 years, then you can't develop or sell the generic versions, things like that. Well, they make an exception or a carve out, the FDA does, for drugs that are in short supply. And that's what happened when Ozempic and Wegovy and Mounjaro came out, is there was such an explosion, such a demand for these medications that they couldn't keep up with them. And people were trying to get them filled, whether they were taking it for diabetes or weight loss or whatever, and they just weren't available. And we still have that trouble to some degree, but they have caught up some with that. So because there was such short supply, they allowed the compounded or generic versions to be sold in the United States, and then that's a market that really exploded too, because again there was such a demand, and they were able to keep up with that better as when these compounding pharmacies started selling it. And that's the program that we have done through my office for several years now, from a pharmacy in Austin, Texas, where we get these. Well, now what's changing now, and we have to kind of see where this is going, but now they've started catching up with the supply on the brand name medications. And so now they are starting to crack down some on the compounded versions. And so they've already put restrictions on them, where they only allow them if patients require a different dosing schedule than is available with the brand name drugs. And so, sometimes we have to look at, dosing it, twice a week instead of weekly, or maybe changing the milligram dosage each time to find a more precise fit for the patient. And then also that still allows us to write for the compounded versions. Now, what's probably coming, and we don't know for sure, but my guess is that in the next maybe year or so that it's going to even get clamped down even more. And I feel like probably at some point down the road, these compounded versions are not going to be available. So that creates different issues. Now, when we're just able to use the brand name, now they have come down some on the prices, but they're still very expensive. You're going to pay minimum of $500 a month, and a lot of times it's a lot more than that when you're paying cash. And the problem is the insurance companies still, most of them don't cover these, and so it's going to become a real expense, which is going to kind of price people out of it a lot of times when it's just because most people can't afford that kind of money for a monthly payment for a drug. And also, it's not just take it for 3 months and you're done. It's something you kind of have to stay on long term.
Well, and to that point, if you have patients that are already on these compounded medications, that basically means that they won't be able to get these medications.
Yeah,
right?
it's going to, people that have been on these for a long time are going to find them harder and harder to get. And we're already seeing that. A lot of the pharmacies that were compounding those have now shut down. And so the ones that are left are really getting overwhelmed, and so now we've got a little bit of a delay getting the medications out to the patients, and I just feel like that's going to get more and more problematic.
And do you foresee maybe clinics or patients across the nation giving pushback to this? I mean, I'm sure this is going to be a pretty hot topic.
They probably will, but I don't know how much good it's going to do. I mean, it kind of goes back to the companies that develop these medications have a patent on them, and as soon as they can meet the need, then they're probably going to enforce that patent, and it's going to be hard to get them any other way.
Right, and then I guess if there is another shortage at one point, maybe the compounding would come back?
It could, but I kind of feel like as they get revved up, it's probably not going to go back to the way it was. So
very interesting.
So we'll just have to see what that does. I think what that's going to do for a lot of folks is going to, we talked about kind of there's the surgery side and the medical side, and I think we're probably going to see an uptick on the surgery side as that occurs, because the surgery is fortunately usually covered by insurance, and so it's typically a much more affordable option than paying $500, $600, $800 a month for medications for the rest of your life. And so I think we're probably going to see more people, taking another look at the surgery side. The other advantage of that, well, I mean, there's several advantages. With surgery and morbid obesity, you do see a better weight loss than you do with the injections. Most of the time, it's going to be a long-term or permanent weight loss, and so once it's done, it's done. And we also see usually the health problems that go along with obesity. We see an even higher cure rate with surgery treating those than with the medications.
Yeah. Well, and you've got both. So, if that does happen, then you still have options for your patients.
And that's the thing. Again, like I said earlier, we do all that. And I talked about how complex obesity is and how complex treating obesity is, and it just seems to get more and more so every year. And so that's what we can hopefully help people do, is provide a way to help them sort of navigate through all this, because most people, I mean, you kind of know what some of the options are out there, but a lot of times people call and they're like, I don't really know what the best thing is, and I get that. I mean, why would you? It's just a lot, and so we really try to come up with an individualized plan for each patient, looking at their weight, looking at their other health problems, looking at their weight loss goals. And that's important too, to look at. Not everybody has the same goal when they want to lose weight. Not everybody wants to be, a stick. And so people have different weight loss goals. And so, we look at all that and then really try to tailor an individual program with each patient to get them where they want to be.
Awesome. Well, if you're just joining us and you have a question for Dr. Barnes, we're talking with Dr. James Barnes with the Highland Clinic. He's a bariatric surgeon, and we are talking about bariatrics, but also weight loss injections. So if you have a specific question to that or anything weight loss related, you can give us a call at 318-219-4569, and we would be happy to take your question. So, we keep talking about obesity, and this is something that like you said, it's a complex kind of syndrome. So tell us a little bit about what you see in patients when someone is presented with obesity. You know, what other things come with that diagnosis?
Yeah, so obesity is, in my opinion, probably the biggest risk factor there is to people's health. I feel like it's worse than smoking or alcohol or anything else you want to put up against it. There are so many health problems associated with obesity that we see, especially as people get older. People in their 20s and 30s can be overweight and usually kind of get away with it pretty good. They don't have a lot of the health issues, but as people get older, 40s, 50s, that's when we really start seeing all these things come creeping in. And so, kind of the big five I always talk about: diabetes, high blood pressure, sleep apnea, osteoarthritis, pain in the weight-bearing joints, the knees, the back, and significant reflux disease. And those are some of the more common and more significant health problems we see associated with obesity. And the great thing is that with weight loss, whether it's medical or surgical, those problems get dramatically better, and we see significant improvement. On the surgery side, we see an 80+% cure rate of all those medical things: high blood pressure, diabetes. Type 2 diabetes is usually cured with a gastric bypass, and it's usually within about a day and a half after surgery. Their blood sugars are back to normal off medications. So, weight loss is not just about the cosmetic aspect. Certainly part of it. I don't mean to downplay that either. I mean, that's a big part of it as well. But there's also a lot of medical implications too.
Yeah. Okay. And so if someone is curious if they are obese, how does someone figure that out? Yeah.
So the numbers we look at, what we use is the body mass index, or the BMI. And it's easy to calculate your BMI, and you can just get online and search BMI calculator. All you need is your height and your weight. That's it. And it's a ratio using those. And what that does, it allows us to kind of compare everybody across the board with a single number. So, if you just look at weight, a woman that's 5'2" and weighs 250 pounds, that's different than a man who's 6'3" and weighs 250 pounds. So, obviously the height plays a big factor in that as well. And so, once you know your BMI, the criteria for treatment for the weight loss injections, the BMI needs to be 27 or greater. And you don't have to be diabetic. Some people, there's a misconception that you have to be diabetic to do the injections, and you don't. There are indications just for weight loss. And then where the surgery starts coming in is a BMI of 35. So BMI of 35 to 40, they generally require you have at least one health problem related to your weight. And again, sort of those five that we talked about are the most common ones we look at. And then once your BMI is 40 or above, they usually don't even require any other medical issues, and then the insurances that cover it will then cover the surgery. And again, the great thing is most insurance companies do cover weight loss surgery, and we take all the payers, the commercial insurance. Sometimes Blue Cross Louisiana does not cover right now, unfortunately. Most of the other Blue Crosses do, as well as the other commercial. TRICARE with the military covers it. Medicare covers it, and we now accept some Medicaid patients as well. So, so most, the majority of people out there are going to have coverage for weight loss surgery.
The best thing would be to, set up a consultation or attend your seminar that you have every Tuesday.
Yeah, so that's kind of the first step. If for people that are interested, and they can just call my office. I'll throw that number out at 798-4433, and we kind of do it a couple different ways. If people are pretty sure that they want to go the surgery route, we do a free weekly seminar to talk about weight loss surgery. I do that every Tuesday morning at 8 o'clock, and we can get set up for that. And then the other thing my office staff will do is they're going to call and verify a patient's benefits to make sure that they do have coverage for the surgery before, because we don't want to make people jump through a bunch of hoops and then find out they don't have coverage for it. So we always check that on the front end, and that's something that my office can do, or patients can do that themselves. All you have to do is call the number on the back of the card and find out if there's coverage for weight loss surgery. Can also check on the medication coverage, the GLP-1s. Unfortunately, that typically is not going to be covered by insurance. And then I have a lot of people that just really aren't quite sure what they want to do yet. And That's what
Yeah.
we were talking about earlier. And so sometimes if they're kind of leaning towards surgery, we'll set them up for a seminar appointment. Sometimes people just want to say, what are my options? And then we'll just make a one-on-one appointment with me, and we'll sit down and we'll kind of touch on all of this and again, try to help sort of guide folks to what's going to get them to their goal.
Right, yes. And so we've talked about obesity is very complex, and I feel like sometimes weight loss in and of itself, the journey can be complex because it's simple formula: eat less than what you burn, right? And but some people have a really hard time with weight loss, whether that's through hormones or genetic factors. So do you feel like that's what you see a lot in your practice, is people that have attempted to lose weight and maybe they just have had a hard time?
I mean, almost everybody that comes to see me has already, I mean, most people have been trying to diet, that are overweight, have been trying to diet their whole life, and so people have tried that, and usually, by the time they decide to make an appointment and come see me, they have realized what I've realized a long time ago, is that it's hard to do this without help. Now, people that are 20 pounds overweight, you can kind of work with your diet and probably tweak that and get where you need to be. But when you start getting into these heavier weight ranges, without help, whether it's typically surgery or medications, it's just really hard to lose a substantial amount of weight, and not only lose that weight but keep it off, and that's obviously a big key as well. And it's just hard to do without that. So most people have tried 100 diets. They've done all the things that they know to do. Because you're right, it is very simple when you boil it down to that. I mean, and we try to keep it simple too. You can get into really get into the weeds, looking at different, dietary stuff. And so we really try to make it simple for people. And how I do that mostly is focus on calories. And that's still, to me, the most important number. There's issues, there's carbs, there's protein, there's, other things that we look at and talk about as well. But boiled down to its simplest approach, it's cutting calories. And it's not so much burning calories, honestly. I mean, exercise. We had a support group last night, and I was telling them there that I always sound like I'm coming out against exercise, and I'm certainly not. Exercise is great for you. I encourage you to do it. Has a ton of health advantages to it. But exercise is not really a weight loss tool. And when you really think about it, most people will kind of admit that, because a lot of times people, I walk 4 miles a day. I've been going to the gym 4 times a week, and and haven't lost any weight. And because it's not a weight loss tool. You don't burn that many calories when you're exercising. And the other problem that sometimes people run into is when we go and exercise, we sort of have this thing inside of us that kind of wants to be rewarded for that. And it's like, okay, well, I went to the gym today. It's okay if I have this dessert, or if it's okay if I drive through Starbucks on the way home, or whatever. And so, sometimes people get into that too. So it's really mostly about cutting calories, and so it's simple, but you can't just say, well, just don't take in as many calories. I mean, it's easier said than done, and that's where we come in to help.
Yeah, for sure. And I love that we both have Apple Watches on our wrist, and you can maybe track your exercise doing that. And I think a lot of people don't realize that they're really not that accurate, and they say that, oh, you burn like this many calories. But it's like you don't really know for sure.
Yeah,
and it could be overestimating.
I'm very skeptical of that, and I get people coming. My watch says I did 10,000 steps today, and I'm like, well, that's great, and it's certainly good for you. But you're probably not losing weight from it.
Okay. Yeah. So you have all these. It's a layered thing, and it's a lot of moving parts. So let's say if somebody is interested in bariatric surgery, this is another big part of your practice. So who is typically a candidate for something like this?
Yeah. So it's mostly based on your BMI, and 40 or greater is usually pretty straightforward. Goes right through. 35 to 40, as long as you have at least one health issue, you're going to be a candidate for surgery. I still, tend, especially people that are in that, the range that I think are really good candidates for the injections are the BMI of 27 to 35, because they're not a candidate for surgery yet. They're not heavy enough, but we do have something that we can offer them besides just telling them to eat less. Yeah. When you get into the 35, 40 plus BMI range, that's when I really tend to lean more towards surgery, because we just see really good results with that. People are going to lose 60 to 75% of their excess body weight with surgery, and it's just really effective. We do 2 operations, the gastric bypass and the sleeve gastrectomy. And they're big surgeries, but they're generally, the complication or the risk of the surgeries are very low. It's an outpatient, it's a one-night stay in the hospital for the surgery, so, almost everybody goes home the next day. Most people are back to work within a couple of weeks. And so it's, while it's a big surgery, it's still, most people go through it pretty quickly and easily, recover pretty quickly. We do the surgery robotically, which is a big part of that now, because we can do it, just through the small little incisions, and with the robotic technology that we use, it does allow people to really, get over it much more quickly. And then, we see great weight loss with it. We see, again, people just get so much healthier, and we have such a high cure rate of all those medical issues that it's just, and I just love seeing that all the time. And, we were talking about that last night at our support group meeting, and it's just fun to see people that have struggled for years and years and years. And some people come to me when they're in their 20s and 30s, but a lot of people 50s and 60s before they finally get to that point. And it's just really fun to see people that have struggled for so long trying to get healthier and lose that weight, and all of a sudden find something that's actually working for them. And it's like they're almost shocked that, they come in, kind of with the mindset, well, I'll try this, but I don't think it's going to work either, because nothing else has. And then, to see them go through the changes that they do, it's very rewarding.
Absolutely, I love that. Well, and so you mentioned support groups, so tell us a little bit about those support groups. Is that with the bariatric patients that you see?
Yeah, it is, and it tends to be more the surgery side, but anybody's certainly welcome to that. And we do those every month or two in my office. We usually do them on Thursday at 5:30, and it's just a good way. I wish more people would take advantage of it, because I think it's great to, and I can talk to people all day long, but I think it's nice to get with a group of people that have kind of either gone through or are going through sort of the same thing, and had the surgery before, and problems that they faced, and that's what we got into last night a lot. Well, what did you have this issue, and what did you do about it? Well, yeah, I had this, and I found that this worked well for me, and there was a lot of that kind of stuff last night, of just kind of trading back and forth ideas and suggestions, and I think the people that come to that find it very, very helpful.
Yeah, it's like they found a group of people that they've gone through the same thing, and they're able to share and glean some wisdom of what they've done before them. So it's great.
And we've had great success with that. And so we actually not too long ago, I have a Facebook page. It's just under my name, James Barnes, MD, and we recently started a bariatric support group on Facebook too. And so and we've had a lot of people jump onto that, and it's just a nice forum where people can. A lot of people will post some of their before and after pictures, which is always fun to look at. But it also is a place where people can pose questions if they're going through something that they're not sure about, and just want to get some get some input from people that have already walked that path ahead of them, and I think that's a great opportunity for that.
Yeah, that's great. Well, if let's say somebody is trying to decide between medication and bariatric surgery, and they're wanting some realistic expectations for each of them. So what can you tell them if they decide the medication route or the surgery route? What are those weight loss expectations?
Yeah, and that's a great question, because I try to be very upfront and very, there's so much out there online that you can read, and some of it's really good, some of it's maybe a little sketchy, and so I really try to give people just kind of honest answers to what to expect. This is not a magic pill, it's not a magic operation, it doesn't fix everything, it's not perfect. But we talk about realistic goals, and with the injection, just talking about weight loss specifically, with the injections, typically people are going to, we hope to see about 15 to 20% of their total body weight. Okay, so somebody that's say 250 pounds. So 15 to 20% of that, it's going to be hopefully about 40 to 50 pounds that we can get them to lose with the injections. With the surgery, we do usually see a little better weight loss. It's more in the 30-35% range. So again, a 250 pound person, might expect to lose, 75 pounds or even more, depending on how heavy they are starting out, of course. But so we look at that number, and obviously these are just estimates. Everybody's going to be a little bit different, but we tell them what an average weight loss, an average result is going to be. We talk about cure rates of whatever medical problems they may be dealing with, because it's an important decision. It's a difficult decision, and I want to give people all the information so they can make an informed decision about it. And so I think you really have to know what are the realistic outcomes, what can I expect, so then they can decide if that's something they want to do or not.
Yeah, okay. And so with the surgery, like let's say afterwards, how does their life change? And obviously the weight loss comes, but then they make some changes to their diet, right? And
yeah, and the diet after surgery, it's very restricted at first. We do, it's liquids for a while afterwards, and then we start some soft solid food, and then slowly add things back into your diet. So it is very restricted at first. The nice thing is though, after the surgery, most people don't have much appetite. It really knocks their hunger level down. And so, I tell people you're going to be on liquids for a while, and they kind of look at me like, I don't know if I can do that. But then after surgery, when your appetite is not what it was before, it makes it a whole lot easier. And so, and again, it's we don't just do the surgery and kick them to the curb. I mean, the follow-up is the aftercare is a huge part of this, and that's we see folks very frequently, especially right early on after surgery, and that's a big part of the success of this as well.
Yes, and so afterwards, if they're wanting to, the aftercare is really important. And I was going somewhere with this question, and now I just, it's Friday.
I see a lot. I've taken care of a number of people that went to Mexico and had their surgery, and I think this is kind of a good example. You can go to Mexico and get weight loss surgery, and and come back. And most people go down and get a good operation, and it's usually a pretty good experience down there. But then what do? You have the surgery and you come back, and then you're just kind of out there on your own. And so, it's very clear that people do better when they it's just human nature, when you
have somebody watching you and monitoring you.
Exactly. Yeah, it just adds some accountability, keeps you focused on it. If you start to veer off the track a little bit, we can catch it early and get you back where you're supposed to be. It's just people just do better when they're being watched and have a little supervision and a little accountability. And I always joke when I say when you know that every so often you're going to have to come back and step on the scale in my office. It just makes you think about taking that extra bite of something when you're at home,
Yeah, and I remember my question really quickly. After the surgery, how soon are people back going to work and back on their feet?
It's pretty quick, really. I mean, obviously it depends on what kind of work you do, but it's very common. I operate on Wednesdays and Thursdays mostly. Most people take the following week off and then go back to work the week after that.
Not bad.
Especially if it's not a physically demanding job. Now, people that are, more physical job and heavy lifting and that, they're going to need a little more time than that probably. But but the majority of people are back in typically about 10 to 14 days.
All right. Well, great. Well, we have a minute left, so tell us. Where can we find you if somebody's interested?
So we're at the Highland Clinic over on Burt Coons. It's attached to the Christus Highland Hospital, which is where we do all of our surgery. And we've got a couple resources. I mentioned my Facebook page, James Barnes MD, or also on Instagram. There's a website for the clinic, highlandclinic.com, and you can go under providers, and I've got some information there under my name. Or just call the office, and that's the easiest way. And it's 318-798-4433, and people can call that number. You'll talk to Taylor or Ashley. We make sure that there's a human being that answers the phone every time. We don't have to push this button and that button, and so and they're both very knowledgeable about all this and can answer all the initial questions and help get folks where they need to be.
All right. Well, thanks, Dr. Barnes. As always, great information. And if you missed this, this will be on our website at ktbs.com/podcast. Thanks for joining us.